We went through every neurosurgeon in Israel multiple times, and none of them had any answers or any resort or any answers of why the deterioration is happening and how to fix it. Started looking abroad, and we got to a specific spinal cord injury institute in Switzerland, and eventually they said they too think I shouldn't do anything and they have no reason or solution. But the doctor there, a doctor called Guy Weisberg, he recommended Dr. Falci and the Falci Institute.
I met Yair about a year ago, so in 2022, he contacted our office from Israel. He was having issues of becoming progressively paralyzed, losing the use of his hands, his arms, his legs. He was having bad spasticity throughout all his body, horrible pain, and a big concern to him as well was that he was losing his ability to compose music, play instruments. This was his life, and hand function, finger function was so bad that he could no longer play the guitar, play the piano. He couldn't sing without severe pain, and he really hadn't been able to walk independently for years, and he was getting more and more paralyzed.
And then we started the process with Dr. Falci. By that time, I was very, I had given up. I was very pessimistic about any outlook of success. I was sure every doctor will come across will just say nothing to do, and keep trying to live with what you have and watch it deteriorate, I guess.
We determined or believed that the continued progressive deterioration of his spinal cord causing all these symptoms, the progressive paralysis and so forth, was due to a condition of tethering or scarring of the spinal cord in the chest region, in the thoracic region, to the canal around it. And that scarring was placing the spinal cord on undue traction or stretch and blocking spinal fluid flow substantially, such that together was making the spinal cord deteriorate further. And that it was our belief we could help him, that if we were to release the spinal cord off of its tether, surgically release the scar tissue on it and around it, make the spinal cord more elastic and mobile in the spinal canal, and restore the flow of spinal fluid through the region more normally, that we could stop this progressive loss of function and even allow him to gain function back.
I came to the surgery thinking, like, Dr. Falci was very optimistic from the get-go. He saw the MRIs, he has enough experience to understand what can be done, what's connected, what symptoms are cause of the spinal cord tethering. But me, I was pessimistic, even flying here.
At the end of the surgery, we were feeling really good that there was a chance he could actually improve function. And within 48 hours, we started seeing improved hand movement, and the spasms in his legs. Normally, if he were lay in bed, the spasms in his legs involuntarily caused the legs to just stiffen, his back to arch back, very painful and debilitating. That had relieved itself. And then by about 5 days out, he was confident his hands were better. He was playing his guitar. And he said he hadn't done that in a year and a half. He couldn't do it. And by a week out, he was walking again. He was walking stronger. He gained new movement in his feet. And that was just a week out. And so, and then he started singing, because he couldn't sing anymore without bad pain. And he started doing that again about a week out. So I think he has a great journey ahead of him, a lot of time to recover and improve, and even the possibility of walking without his walker because he's gaining strength daily.
But any hope was far from what eventually happened, and the success and seeing function return, and that I haven't seen in 12 years, seeing being able to do things that I haven't been able to do for a while, so fast after the surgery. I'm able to sing, I'm able to play, I'm able to walk with a walker right now, but at the rate things are improving, I don't see any reason why I won't be able to walk without any accessory in the near future, in the next 6 months, a year. They say that even after a year you can still see improvements and changes in the spinal cord, positive changes. So I have things to look forward to. In a long time that wasn't the case. Doctor, doctor, tell me it's true. Everyone says that there's nothing to do, but you see it different and claim you can lift this boulder that's holding me down. Doctor, doctor, how can you know this? Everyone's given a failing prognosis. I'm not a believer.